Hello, my name is Ronnie Punungbayan, and this is my volunteer MJ Nazarino. And today we will be going over some rehabilitative exercises for three types of injuries commonly occurring in basketball: the ankle sprain, the ACL injury, and patellar tendonitis or jumper's knee. This first exercise will be for ankle sprain rehabilitation. So MJ's right ankle has been sprained, and now we are going to try to work on the stabilizing muscles of her ankle, the peroneals and the posterior tibialis muscles. One of the effective exercises would be single leg balance training. So if NJ has sprained her right ankle, you would have her lift up her left foot and stand solely on her right. And she would hold this for about 30 seconds. We would do 2 sets of this. You would do this twice a day, every day. To make this exercise more challenging, I would incorporate some sort of reaching outside of her center. So I would have her toss a ball, or we would toss a ball to each other while trying to maintain her balance. She may perform this exercise near a wall or a chair in case she feels like she needs to lose her balance. The second exercise would be the straight leg raise. And this is because during or after ACL injury, the quadriceps becomes inhibited, and which will lead to muscle weakness. So if MJ has had a left ACL injury or has had an ACL reconstruction, she would have weakness in her left quadricep. So for this particular exercise, I would have the patient or MJ laying in supine. I would have them flex their right knee about 90 degrees with their foot flat on the floor. And then I would have her dorsiflex her left ankle and contract her left quadricep. And while maintaining this position of dorsiflexion of the ankle and quadricep contraction, I would have her flex her hip or elevate her leg to about the level of her right knee, about 45 degrees, and hold for about 1 to 2 seconds, and then slowly lower back down to the ground, keeping, there you go, the contraction and the dorsiflexion. I would have her perform this exercise about 10 repetitions for 3 sets. And I'd have her do that twice a day, so about 7 days a week. To make this exercise more challenging, I would add a weight or some sort of resistance to her ankle. However, I would be cautious not to put too heavy a weight on the tibia, as it may cause added strain to the ACL ligament. Now for this final exercise, this is for patellar tendonitis, or otherwise known as jumper's knee. What happens is the inferior patellar ligament gets inflamed from repeated forceful extension of the quadriceps and the knee. The quadriceps will pull on the patella, causing inflammation at the inferior patellar tendon. So the way to rehabilitate this is to progressively load the patellar tendon so that it becomes accustomed to the forces of the jumping. So what I would do first is focus on eccentric training of the quadriceps. So I would take a stool and have her step on the stool. If her right knee were the injured knee, I would have her step on the right and slowly lower her left heel towards the ground. And she can bend her right knee and hold on to something if she were feeling unstable. Good. Try to maintain as much dorsiflexion in that left as possible. There you go. This will help them maximally bend the right knee and put the eccentric force on that tendon. To make this exercise more challenging, you could use a higher step, or you can progress to a jump down, which would be to jump down from the box and land slowly into a squatted position. So these are the exercises for the 3 injuries: ankle sprain, ACL injury, and patellar tendonitis. Thank you.